please sign in. Also, there's raffle tickets if you want to join the raffle to win some stuff from the Peer Counseling Center. We're going to start off with an activity. So basically everybody's going to be given a slip of paper with either a list or a word. So if you have a list, you have short-term effects of a substance if you take it. And then the people who just have a word, that is the substance, which means you have to find your pairing. So if you have a list, make sure you find your word. And if you have a word, make sure you find the list that goes with it. So there's going to be repeats. So if someone has what you, like if you're, let's say like alcohol, and you found like the person that has like the list of short-term effects that go with alcohol, but they already have a person, you need to move on and find a new person. So as soon as everybody signs in and Sarah finishes giving out the slips, we're going to do the activity. So the objective of this for right now is to make sure you find the other person and then discuss and like introduce yourselves. So for everybody, I just want to introduce myself. My name's Thuy, and I'm a peer counselor at the Peer Counseling Center. Does everybody know what the Peer Counseling Center is? Awesome. So the topic today is drug and alcohol use among college students. Does everybody have a slip? Great, so if you have a slip, you can start mingling and trying to find your pairing. Raise your hand if you don't have a slip.
Who got substance? Who got substance?
So like you either have a substance title or a list of the short-term effects.
I got short-term effects.
I'm confused.
What'd you get?
The
You
goal
don't get
is to go around and mingle.
Oh, you're just recording.
Yeah.
Good job.
Thanks.
I don't know what to do.
Me either.
And take a picture.
Go.
I have marijuana. If you need a slip, come to Sarah over here.
Richard, go in that.
We're figuring it
I think I
out.
left it over there.
I'm marijuana. I'm trying to find side effects of marijuana. Let me see.
Yeah, let's see.
Do you have a list? Pepper, what do you have?
I think I have
If you don't know the side effects, just take a guess. An educated guess, we're gonna go over it. And, like,
I don't have.
Yeah, because nausea.
That's what I'm telling you. We all have, like, some people have the same. She said there's double.
Intention for
that's what I was thinking.
sign in.
Yeah,
What do you guys think? More cocaine. Why did you Adderall?
Okay, so there's multiple cocaine.
What does it sound like to you guys? Appetite suppression, unhealthy weight loss, irritability, trouble sleeping.
This is for bio.
So do we have to do anything?
Yeah, that's stuff
Potentially intense
I don't know where the side is.
Right there.
invigoration,
It's right there.
feelings of euphoria, feelings of depression, increased irritability.
What are the options?
I don't think you get the question.
Whenever everyone else has
Cocaine? Yeah.
Adderall, marijuana, there's
Yo.
What do you do if you find your match?
Then you
You're
stay
lit.
with them.
You're lit.
Okay.
What do you have?
So stay with
There's
your
like 3
partner
cocaine.
that you found, and then we can.
Okay, come here.
You have alcohol, right?
Who doesn't want the Kool-Aid? Yeah,
Maybe not. Let me see yours.
Me?
Yeah, what do you have? Appetite suppression. I nice last. I don't know.
This could be like 20 different things. This sounds like me in the morning. Like, I don't know. Really? Unhealthy weight
We
loss?
have like 1 more minute. So find your pair.
We're gonna stick here. Oh yeah. Find some other.
Richard, what is your side effect?
What?
What's your side effect?
Appetite suppression and unhealthy weight loss, irritability, trouble sleeping, feelings of restlessness,
What's your list?
potentially dangerous cardiac issues. I feel like this is Adderall.
Short-term
Yeah.
memory problems,
Okay.
severe anxiety, hallucinations, panic, loss of sense of personality.
I have marijuana. Anybody? I think it's
Wait,
cocaine.
who- you
No,
had
the
Adderall?
list. I mean.
Who had Adderall? You had Adderall? Did you find your partner? Damn it. Okay, I think I'll be your partner.
I don't know anything.
I'm gonna steal Karen.
Okay, everybody, we're gonna end this portion of the activity. Alright, so take a seat wherever you are. So the first one we have is alcohol. Where are the people with my substance titles for alcohol? Anybody? Did you find your correct partner? Did you pair up with someone else that had different short-term effects? Does anybody want to read the short-term effects of alcohol?
Vomiting, diarrhea, stomach, headache, breathing difficulties, distorted vision and hearing, impaired judgment, decreased perception and coordination, unconsciousness, anemia, coma, and blackout.
So the next one is cocaine. Where's my cocaine peoples? Did you find your correct pairing?
Yes.
Alright. Does anybody else want to volunteer to read the list?
Loss of appetite, increased heart rate, blood pressure, body temperature, contracted blood vessels, increased rate of breathing, dilated pupils, disturbed sleep patterns, nausea, hyperstimulation, bizarre, erratic, sometimes violent behavior, hallucinations, hyperexcitability, tactile hallucination that creates illusion of bugs burrowing under the skin, intense euphoria, anxiety and paranoia, depression, intense drug craving, panic and psychosis, convulsions, seizures, and sudden death from hypothermia.
So the next one's marijuana. Where are my substance label peoples? Alright. Can someone read off the short-term effects for marijuana?
Short-term memory problems, severe anxiety, including fear that one is being watched or followed, paranoia, very strange behavior, seeing, hearing, or smelling things that aren't there, not being able to tell imagination from reality, psychosis, panic, hallucinations, loss of sense of personal identity, lowered reaction time, increased heart rate, risk of heart attack, increased risk of stroke, problems with coordination, impairing safe driving or playing sports, sexual problems for males, up to 7 times more likely to contract sexually transmitted disease or infections than non-users for females.
Adderall. Who are the Adderall people? Did you find your pair?
Yeah.
Do one of you want to read the short-term effects?
Appetite suppression and unhealthy weight loss, irritability, trouble sleeping, feelings of restlessness, potential dangerous cardiac issues, intense invigoration, feelings of euphoria, fatigue, feelings of depression and lethargy, increased irritability, decreased ability to concentrate.
Great. So we're gonna have a little bit of a discussion because I made you guys walk around. So So by show of hands, who found the right partner? So almost everybody. That's great. Okay, so can someone tell me the purpose of this activity?
Well, it's good to be, I feel like you shouldn't be ignorant about all of these types of drugs. It's good to be, you know, educated on them. A lot of people really don't know, and you would think that you would.
So the other purpose of this activity was basically to give you some sort of idea of the types of drugs and substances that I'm going to be focusing on today, and also allowing you to kind of interact with each other and look at, like, absorb information in a different way. Okay, so from the list of short-term effects, which were surprising, predictable, confusing, because I know some people were confused because they're like, I don't know, cocaine like that. So, are there any like short-term effects that like stood out to you?
For marijuana, I didn't know like it was up to 7 times more likely to contract sexually transmitted infections.
So that statistic is basically coming from the fact that your inhibitions are lowered, and when your inhibitions are lowered, things occur that shouldn't, and you don't want to. So, all right, so we'll move on. So why do you, as college students, consume alcohol or take drugs, or think others do? Any reasons?
Structurally.
Anything else? Focus? Any other ones?
Increase your productivity.
So the top 4 reasons for substance use is stress, course load, curiosity, and peer pressure. Does everybody agree? Anybody like shocked by these things? Nope. Does anybody want to share a situation where any of these things was stress? Stress? Okay. Do you have like a specific story or midterm week? Midterm week? Yep. Okay. So some information. So there was a survey that was done in 2014 called Monitoring the Future, and they looked at college students and adults who weren't in college, and 4.3% of these participants reported drinking daily. And then 35.4% of the college students reported binge drinking within the last 2 weeks. And 42.6% of college students reported being intoxicated within the last month. So if you look at the picture right here, it shows the difference between people who are in college and who aren't in college. Can anybody tell me why there might be a difference between the two?
Because when you're in college, like the people who aren't in college are just working and they're coming home and they have nothing else to do besides their like household work. But when you go to college and you also work and you have all your household chores, you have like so much stress building up in your life that you're like, I want to drink with dinner, or I'm going to go to the bar for lunch.
I think it's also like the environment you're in college, especially like if you're on a campus, it's a lot different. There's a lot more parties going on. Like there's a lot more opportunities.
Okay. So you were saying about being on campus. So because John Jay isn't necessarily a campus, what would you say would be the reasons why there's a difference between college student and the non-college student, like in comparison to John Jay? This is like, there's no right or wrong answer. Like, this is just like the discussion.
There's dorms, there's like easy access to places to drink. And then people usually have cars, so there's a mode of transportation to like find a liquor store that's now underage.
So you can tell me what binge drinking is.
Is it like drinking every day? Non-stop?
No. Yes, so it's drinking in high amounts. So, but there is a specific amount that is associated with binge drinking. And do you think that the amount is the same for everyone, or is it different? So, according to the National Institute on Alcohol Abuse and Alcoholism, binge drinking is a pattern of drinking that brings the blood alcohol level to 0.08. And that can mean different things, obviously, because blood alcohol level depends on different factors in people. So you can, like, if you are taller, you weigh more, or any of those factors, it might take you longer or more drinks to get to that blood alcohol level. But on average, it's 5 drinks for the average male, and it's 4 drinks for the average female, and it's within 2 hours. So that means you're drinking 4 drinks in 2 hours for the females, and if it's a male, it's 5 drinks in 2 hours. So what do you think is the standard drink? Because we're just talking in terms of drinks right now, because everybody has a different size of drink.
It's 1.5 ounces of hard liquor. It's like 12 ounces of beer. It depends on like alcohol by volume.
Okay.
Percentage. Yeah.
That is correct. So this is the standard drink in the different types of alcohol. So for beer, which is about 5% alcohol, it's 12 ounces. And if it's like a liquor, like a malt liquor, so it's about 7% alcohol, and that you only need 8 to 9 fluid ounces for it to be a standard drink. And then wine, it's 5 fluid ounces, which is 12% alcohol. And then in like distilled spirits, which is like the vodka and like whiskey and things like that, it's 1.5 fluid ounces, and that's 40% alcohol. Does this change your perception of how much you're drinking based on the size of your drinks and how much alcohol you're putting in it? I see a lot of faces, go off the top. Okay. So consequences of alcohol use in college. So these are just some statistics. 1,825 college students between the ages of 18 and 24 died from alcohol-related unintentional injuries, including motor vehicle crashes. 696,000 students between the ages of 18 and 24 are assaulted by another student who has been drinking. 97,000 students between the ages of 18 and 24 report experiencing alcohol-related sexual assault or drinking. Roughly 20% of college students meet the criteria for an alcohol use disorder. About 1 in 4 college students report academic consequences from drinking, including missing classes, falling behind in class, doing poorly on exams or papers, and receiving lower grades overall. So, does anybody want to talk about how significant these statistics are? Or like any reactions that you have to them?
The date rape one, 97,000 students. That's crazy.
And this is just a statistic, which also means that there might be a lot more that haven't been reported or people haven't talked about.
From what year?
So these statistics are from 2014. So how many of you know what alcohol poisoning is? Can I get a show of hands? Okay. So a lot of people don't know what alcohol poisoning is, and they don't know that it is a consequence of binge drinking or drinking heavily. So I have a few things about alcohol poisoning. So alcohol poisoning occurs when high levels of alcohol suppresses the nervous and respiratory system, making it difficult for the body to get rid of alcohol in your system. That means your body is rejecting the alcohol,